Good afternoon, everybody. Happy Wednesday. I hope everyone is safe, sound, virus-free. I'm praying for all of you. A couple questions came up. Number one, if hydroxychloroquine was causing cardiac issues in patients taking it during the study, during the trial, why wasn't that an issue prior when people were taking it for malaria or for lupus? Well, actually, we've known that Plaquenil, hydroxychloroquine, has many side effects. Those side effects affect everything from skin to nails to liver and kidneys to lungs and heart. It's actually a medicine that needs to be monitored very closely on patients who take it. As far as malaria goes, malaria is fatal. So, although Plaquenil may cause adverse effects, doctors always have to weigh the risks and the benefits. And the benefits of the medicine outweigh the risks with regard to malaria. And that's also true with lupus and other autoimmune diseases it may be used for. So to answer that question, the heart of patients taking hydroxychloroquine should be monitored. In our office, we do periodic EKGs, which is when you put the leads on the chest to look at the electrical activity of the heart. And number two, occasionally when necessary, we do repetitive echocardiograms, which is an ultrasound of the heart. I don't have a lot of patients on Plaquenil. That medication is normally prescribed by rheumatologists. But for the patients that I do have on it, I'm monitoring their heart every 3 to 6 months to make sure they don't have heart disease. And I've done that for years. Someone brought up about this virus and compared it to the Spanish flu from 1918, and said we should just do what they did with the Spanish flu to make, that made the Spanish flu go away. Well, let me tell you that there are many theories on why the flu epidemic of 1918 went away. It actually was, number one, we know that it was devastating. But once it left fairly quickly. And there are a couple theories out there, and they're only theories. We're not able to go back and prove what worked and what didn't work. Many things were tried during that epidemic. What I understand is the prevailing theory in medicine, understanding viruses to the limit that we do, and we are limited by our understanding of viruses. Our understanding is that the virus, the H1N1 virus, flu virus, actually mutated to a less virulent form, and our own immune system was able to knock it out. It does occur at times where a virus that is devastating mutates to a less lethal form, not killing people, and then our immune system does the rest. We don't know if this will happen. We can't plan the mutation. We can't fix the mutation to occur. unless people are following the recommendations that are put out by doctors, not politicians, not the media, not social media, but actually the suggestions, the recommendations that are put out by your physicians of facial coverings, social distancing, sheltering in place when necessary or frequently. Unless those things occur, there's only two ways to get rid of this virus, two other ways. Number 3, divine intervention, okay? And I'm all for divine intervention. I'm praying every day for divine intervention. Number 2 would be that, again, this virus, like what is theorized in 1919 of the flu of 1918, that the virus actually mutates to a less lethal form. Or number 3, that we get a vaccine. We don't have a vaccine. We have facial coverings and the recommendations that people can do, or we can hope for a mutation. We're taking a big risk by hoping for a mutation. We're still a ways out from getting a vaccine. Multiple ones are being studied right now. We know that. A few are in clinical trials. We know that. We spoke about that. But we don't know which one, if any, are going to be effective. Unless we practice social distancing, unless we wear facial coverings, we're in trouble. Wash our hands frequently. Shower with soap and water a couple times a day. Wash shoes with soap and water. Wash clothes with detergent, obviously. Unless we do those things, we're still going to have increased numbers of people with this virus, and we're going to have increased numbers of death, and we're going to have increased numbers of children being ill, very ill with this. We just have to do it. We just have to do it. You know, we just have to do it. You know what to do. You listen to this video. I'm praying that society, not just the people watching this video, but people not watching this video, start, doing the right thing, being an appropriate citizen, protecting our neighbors, protecting the elderly, and now protecting children from this devastating illness. I'm all for an easy out. Let this thing mutate and go away and we're home free. But this virus is not predictable. In fact, it's very unpredictable from what its characteristics have been so far. So, on those thoughts, I continue to pray for everybody. I appreciate all those watching the video. I appreciate all those sharing the video. I know a lot of you are spraying it out there. I will continue to just give you facts. I will continue to give you what I know. I will continue to give you non-politicized information. Have a good night, everybody. I look forward to talking to you again tomorrow. Bye-bye.